Hello, thanks, Jason. And hi,
Okay.
everyone. I'm Pumi from Mediwave. So just imagine, my father is alone at home in his late 70s. He's experiencing a chest pain. And in Sri Lanka, he would dial 1990, the pre-hospital emergency care ambulance service. And today, 1.8 million people dial this hotline for emergency assistance. In the story I just mentioned, we were lucky because we live in the suburbs. But majority of Sri Lankans, that is 80%, live in the rural communities. So road infrastructure congestion is massive, and we believe it is not, in terms of the, believe it or not, the average bed scarcity that we have in Sri Lanka is 4 beds per 1,000 patients. In terms of ETU delays due to massive manual recording, and also we have a lack of specialist doctors due to mass migration from Sri Lanka to different developed countries, and therefore the healthcare sector is struggling at the moment. So let's cut to the chase in terms of what are we solving at this point. So we're solving the golden hour of care dependencies, quality of triage, and accessibility. And we're empowering the government and an entire ecosystem of healthcare professionals end to end. So why are we different? Because we provide proactive patient care with intelligent and immersive technology, digital first and AI-led because time is life. And we are also impact-led because we are in the business of saving lives. We enable all of this through IoT, AI, mixed reality, 4G and 5G mobile first to empower what first responders do best, that is patient care. So here's a solution. As you can see, it's an end-to-end emergency response suite, merging documentation, intelligent dispatch, in-ambulance services, and case reporting with AR capabilities for vital signs monitoring and remote consultation. So here you see a commercial model where each of these can be consumed in a modular basis, depending on the need of the moment, and also to take on a go-as-you-grow basis. We have an enterprise and SaaS solution, and these are on one-time installation fees and subscription fees. So let's go to the impact we create, and especially this is a case study in Sri Lanka. 98.9% of the calls made are answered in the first ring. Less than 2 minutes call to wheel time is achieved, and under 12-minute nationwide response time surpassing some of the developed countries. Average, we help save 1,000 lives daily, and 2,000 EMS technicians use our technology. 400 ambulances are powered, and approximately 13 million USD is saved in terms of government spending. Also, 34% of public deaths in Sri Lanka happen due to heart disease. And as you can see from the next slide, most of the 48% is covered through heart-related diseases. Our solution is active in multiple countries and in POC stages in some regions.
So sorry, I have to stop you there. So sorry about that, but thank you. You can keep the slides up. You can keep them up, and then we'll go to our jury members for questions. Yes, Saba.
First of all, congratulations. It's really interesting. I have two very quick questions. How did you train the AI based on what data? And a follow-up question on that, if the triage is not precise and there is a mistreatment, who is responsible for that?
Okay, so the first, to answer your first question, we use OpenAI in our AI training models. And also we use past data because the ambulance service has been active for the past 9 years. So we use past data manually for training in terms of specific LLM. So that data is used, and the model continuously learns because the AI capability for speech to text is a rather new application in Sri Lanka. And that speech to text is used for the digital EPCR. And that is a work in progress where through test cases that we keep improving our language models. And to answer your second question, who is responsible when the triage is not properly looked into? In a general scenario, systems are manual. That is in the Sri Lankan healthcare ecosystem, most of the systems are manual. So through the emergency ambulance service that we have in Sri Lanka, we have been able to empower, rather digitize some of these manual processes using the end-to-end ERMS and the EPCR solutions. And the responsibility completely lies with the emergency response team, who are the paramedics.
Okay, thank you.